this is occipital bone. Occipital, ob plus cipit. They are Latin words. Means ob means back and cipit means head. That it forms the posterior aspect of the head. It lies in the posterior aspect of the skull bone. Okay. And its anatomical position, as this is unpaired bone, it is single, and anatomical position is such that this foramen magnum, it should, the big aperture in this bone, it should go straight downward like this. Okay. And convexity, the convexity of the flattened surface should face backward, where is the cruciate impression on the anterior aspect. This should face anteriorly like this. Okay. And the apex should face upward. Here this is apical part should face upward and foramen magnum straight downward. Okay. Now it has got three part. This bone has got three part, that is flattened squamous part, this condylar part, and this much is the basilar part. First coming to squamous part, that is the flattened part. It has got two surface, that is external surface and the internal surface. There are four borders, that is two superolateral border and two inferolateral border. Three angle, that is this much is the superior angle and two inferolateral angle. This one and this one, two inferolateral angle. First coming to the attachment on the external surface of this occipital bone. Okay. At the center of this, the external surface, there is a protuberance. This is known as external occipital protuberance, and the midpoint of that is somewhat elevated, and this is known as inion, I-N-I-O-N, inion. From here, this point, few lines are diverging out, like one is this one on both sides, in the right side and in the left side. Now this one towards the right side and this is left side. Okay. So the highest one is the highest nuchal line. This is highest nuchal line and this one is superior nuchal line. And you can see this is inion, and from inion up to the midpoint of the posterior border of foramen magnum, this is an elevated ridge. This is known as external occipital crest. And from the midpoint of that external occipital crest, two transverse line horizontally passing both sides. Okay. This is known as inferior nuchal line. Okay. Now coming to the attachment over there. We can memorize by a mnemonic. Suppose this is the inion, I for inion, and this is foramen magnum, and this is the external occipital crest. Suppose one lion is standing here. Suppose this bone is a lion, okay, and here is mouth. Foramen magnum is mouth, and lion at the center, that is the ligamentum nuchae. From inion up to the posterior border of the foramen magnum, this crest give attachment to the ligamentum nuchae, LN, ligamentum nuchae, lion, and these are like two eyebrows, highest nuchal line and the superior nuchal line. And the mnemonic is go, terrific Smita Sudarshana, so roar. Lion is standing at the center, so who can dare to go there? So no one else except Smita Sudarshana. So go, terrific Smita Sudarshana, so roar. Then what is go? Decode this. On the highest nuchal line, medially, there is for both sides, medially, Gallia epineurotica. This one up to here and also here and also on this surface, Gallia epineurotica. And on the lateral aspect, this is go, that is occipital belly of occipitofrontalis muscle. And on the superior nuchal line, that is here, superior nuchal line, terrific Smita Sudarshana. Terrific Smita Sudarshana. That is trapezius, sternocleidomastoid, and just below that, splenius capitis. Okay. And now this area, this is the superior nuchal line and this is inferior nuchal line. And these two area now divided into four cubical part like this. 4 cubical part. And what is the arrangement? Soror. S-O-R-R. That is, here is the splenius capitis. This S is splenius capitis just below the sternocleidomastoid. Smita Sudarshana. So here is the also capitis, semi-spinalis capitis, not splenius capitis, it is semi-spinalis capitis, and O for obligus capitis superior. Okay, and roar, R. This is rectus capitis posterior minor and rectus capitis posterior major. Minor is always protected by major. So the arrangement is like this. Now coming to the anterior surface or internal surface, this you can see the cruciate impression, and this point is known as internal occipital protuberance, and the crest, this one from here to here, only this much is the internal occipital crest. And this has this internal occipital protuberance has great clinical significance as this denotes the confluence of sinuses. Here many sinuses meet, that is from horizontally or transversely, they are transverse sinus, from above the superior sagittal sinus, and from inferiorly occipital sinus, and from anteriorly like this, like my pen, like this. Okay, anteriorly there is a straight sinus. So this is the meeting point of all these sinuses, from above superior sagittal, from both side right and left transverse sinus, from inferiorly occipital sinus, and from anteriorly this is a straight sinus. So it forms the confluence of sinuses, and this ridges, this sinuses lies in this sulcus, that is the groove, and just by the side this you can see the ridges. This give attachment to above, it gives attachment to falx cerebri, below falx cerebelli, and these ridges give attachment to tentorium cerebelli. So above is the supratentorial compartment and below is the infratentorial. This triangular hollow give a space to the posterior part of the occipital lobe of the cerebral cortex, and these two, the quadrangular hollow, give a space to the cerebellum, and this much, this small space, this triangular, this is known as Vermian fossa, give a space to the vermis of cerebellum. Now coming to borders, this is superolateral border and this is to inferolateral border. This superolateral border, it articulate with the like this, the anatomical position like this. So it articulate with the posterior border of the parietal bone. Here lies posterior parietal bone. So posterior border of the parietal bone articulate with this, and here also one parietal bone articulate with this to form the parieto-occipital suture. Okay, and all together this whole from here to here, this is known as lambdoid suture. From both sides altogether known as lambdoid suture. Okay, and this one, the inferolateral border, it articulate with the inferolateral border articulate with the posterior border of the mastoid part of temporal bone like this. This is temporal bone and this one is the mastoid part, and this is posterior border of the mastoid part, this much. So it articulates with the posterior border of the mastoid part of temporal bone like this, and form the occipitomastoid suture both side. Here is the right occipitomastoid suture, is the left occipitomastoid suture. And this superior angle, it forms the lambda. Here lambda is formed, which is the formed by the two, this union of the sagittal suture and the lambdoid suture. And this is the site of posterior fontanelle. And this one, this is the inferolateral angle. It forms the site of asterion. This is asterion, and it is the meeting point of, please ask OTP, ask for asterion. It is the meeting point of three bone, that is OTP, that is occipital bone, temporal bone and parietal bone. Here lies the occipital bone, this is, here lies the temporal bone, and this here lies the parietal bone. So it is the meeting point of three bones, as well as the three suture, please, that is P for parieto. Here is the parieto-mastoid suture, and this is occipito-mastoid suture, and here is a lambdoid suture. So please, P for parieto-mastoid suture, L for lambdoid suture, and rest is ease, and you can easily memorize occipito-mastoid suture. So this is the meeting point of those three. Now come, this is, we have completed external surface, internal surface, border, angle, and now come to the, this is basilar part and this is condylar part. This condylar part has got lateral part and medial part. Okay, lateral portion is like a process, this hole, this is known as jugular process. It has got superior surface, anterior surface and lateral surface. Superior surface, where this blue color is, it is like a sulcus and it gives space to sigmoid sinus. Anteriorly, it is somewhat elevated. This one is somewhat elevated, and this is like a this is jugular tubercle, and it articulates with the jugular tubercle of petrous part of the temporal bone, like this. Here is the also jugular tubercle. Okay, and the lateral surface articulate with the posterior part of the, this is anterior part, and this is posterior part of the posterior border of petrous part of temporal bone. This is temporal bone and this is petrous part, and this is posterior border and the posterior part of the posterior border here. Okay, so here it articulate. And so we have talked about the superior surface, and this is lateral surface, and anteriorly it articulates with the jugular tubercle, as well as it forms a foramen, incomplete foramen. This is known as jugular foramen, which is completed by the, this is notch, and it turns into a foramen, same as jugular foramen lies on the petrous part of temporal bone, like this. And this jugular foramen is contained from, it is divided from anterior to posterior aspect into three compartments. This is anterior compartment, middle compartment and posterior compartment. Anterior compartment gives space to inferior petrosal sinus, whereas the posterior compartment gives space to sigmoid sinus, this SS, sigmoid sinus, this one. And in the middle there is 9th to 11th cranial nerve, that is 9th, 10th and 11th cranial nerve. Many people know this, but very few people know that the anterior compartment also gives space to meningeal branch of ascending pharyngeal artery, whereas the posterior compartment also gives space to meningeal branch of occipital artery. Okay, this is our jugular foramen. Now coming to medial portion of the basilar part. This medial portion, one is left, that is the inferior surface of the lateral part. This is the inferior surface of the lateral part of the basilar portion, and it give attachment to the rectus capitis lateralis, as this lies on the lateral aspect like this. So rectus capitis lateralis, and posteriorly rectus capitis posterior, and in the basilar part there is rectus capitis anterior. Okay, so here is the attachment of rectus capitis lateralis. Now coming to the medial portion of the condylar part. Medial portion has got, this is superior surface, here is the medial surface, and one is inferior surface. About the superior surface, there is one groove, this one. There is a groove. It gives a space to here, from here the 9th, 10th, 11th cranial nerve run and then enter into jugular foramen like this. Okay, so 9th, 10th, 11th, this groove is for that. And on the medial surface you can see there is one tubercle. This is tubercle here. This is tubercle and this is one foramen. This foramen is known as hypoglossal foramen, and it gives way to hypoglossal nerve as well as the meningeal branch of ascending pharyngeal artery. Same as that of here, meningeal branch of ascending pharyngeal artery along with the hypoglossal nerve. And this tubercle give attachment to alar ligament, which divide this foramen magnum into small anterior compartment and large posterior compartment, this tubercle. Okay, and on the inferior surface what we are seeing, this is the condyle. Inferior surface of the condylar part bears a condyle. This is occipital condyle on both sides, as it is like this. So this one is the right condyle and this is left condyle. It articulates with the superior articular process of the atlas, that is the C1 vertebra, and to form the condyloid variety of synovial joint. Okay, now this condylar part, this condyle lies on the inferior surface of the medial portion of the condylar part, and along with the condyle on the inferior surface there is two foramen. Along with the occipital condyle there are two foramen. This is anterior foramen and this is posterior foramen. Anterior foramen, this is the external opening of the hypoglossal canal. Okay, hypoglossal canal or hypoglossal foramen, which give space to the hypoglossal nerve as well as the meningeal branch of the ascending pharyngeal artery. Okay, and this is the posterior condylar foramen, as it lies posterior to the condyle. So it is posterior condylar foramen. It lies within a fossa. This is known as condylar fossa, and it gives space to emissary vein connecting the suboccipital venous plexus with the sigmoid sinus. Here lies the sigmoid sinus and it connects suboccipital venous plexus with the sigmoid sinus. So this is all about the condylar part. Now coming to basilar part. This basilar part has got, this is anterior surface, superior surface, here is the inferior surface and two lateral border. Lateral border articulate with the posterior border of petrous part of temporal bone. Where is the anterior surface? It articulate with the posterior surface of the basilar part of the sphenoid bone. Same as that of here, there is one basilar part in the sphenoid bone which lies just in front of it, and then form a primary cartilaginous joint that will get ossify at the age of 25 years. Okay, and this superior surface is very smooth and it is known as, it forms the posterior part of the clivus on which medulla oblongata rests on, and even posterior to that, where this line is, this one, it give attachment to, from anterior to posterior, massa, that is MSA, membrana tuctoria, S for superior band of cruciate ligament and A for apical ligament of Dens. massa. Okay, and on the inferior surface, here you can see there is one tubercle. This is pharyngeal tubercle at the center of the basilar. At the center, this is pharyngeal tubercle. This one is the pharyngeal tubercle. Like this it lies, and it give attachment to the pharyngeal raphe. This is the pharyngeal tubercle, this is anterior and this is posterior aspect, and here lies pharyngeal raphe, straight, coming straight downward, and it give attachment, this pharyngeal raphe give attachment to all the constrictor muscle of the pharynx, that is superior constrictor, middle constrictor, and inferior constrictor. So this cubical part, that is the basilar part, we are dealing with the inferior surface, and it is like a cube, and anteriorly here lies one ladka. One ladka is standing here. Ladka, that is L, RCA. Anteriorly there is attachment of longus capitis, and posteriorly RCA, that is rectus capitis anterior. Here you can see this is the anterior aspect and this one is posterior aspect. Here is the anterior. So this one longus capitis, and here posterior aspect, this is rectus capitis anterior. So rectus capitis anterior, here lies rectus capitis lateralis, and here is the rectus capitis posterior in this area. Okay, and even posterior to that is the attachment of three fossa. That is, just by the side of foramen magnum, there is prevertebral fossa, then comes buccopharyngeal fossa, and then pharyngobasilar fossa. As pharynx lies here, so pharyngobasilar fossa, and then buccopharyngeal, and most posteriorly is the prevertebral fossa. Okay, as the vertebra lies here, so prevertebral fossa. This is about the inferior surface. Now coming to the foramen magnum. Foramen magnum, you can see, you can imagine that is a man, and here lies two eyes. Lies two eyes. This is suppose this is forehead, and one massa is there. Massa, a big mole. Massa is what? Membrana pectoris, superior band of cruciate ligament, and apical ligament of dens, passes from the small anterior compartment, which is supposed to be the forehead. You can imagine. Okay, this one is anteriorly, this is forehead, and posteriorly from MMS, CVS, and APSA. MMS is what? This is, here you can see MMS, that is medulla oblongata, meninges, spinal accessory nerve. Then CVS, that is meningeal branch of C1 and C2. V for vertebral artery, S for sympathetic nerve, CVS, and APSA is anterior and posterior spinal artery. These are structure passing from foramen magnum. And this foramen magnum, anteriorly it give attachment to anterior atlanto-occipital membrane, and posteriorly posterior atlanto-occipital membrane. So this is all about the occipital bone. Thank you.